order. And I'd like to have us stand to say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call. We have legislators Elaine Daly, Brian Muldrow, Robert Shea, and Tom Winslow. Our first order of business is to approve minutes of June 11th.
I'll second.
Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Carries. We have one appointment with the Board of Health, Donna Souls. This will actually go before us at the full legislative meeting, so it is on our agenda for our information in advance. So I'd like to begin with department updates, and we'll go right through the agenda as it follows. And Kathleen Cuddy, you're up.
Good evening, everybody.
See you.
You'd like us to do resolutions first?
Sure. We have two health resolutions, HH3 and HH4, which was originally in draft, but sent out to us with the appropriate account numbers. So HH3 is authorizing the public health director to contract with city VOCES for the provision of audiological services for children eligible for the 3 to 5 preschool program.
Yes. That's so HH3, it's a very unique service, and City BOCES is one of the few places that does offer it. Fortunately, you know, for many of our children who need an assessment, they don't often need this level of expertise, but it's a great service. It's special rates because they are the only game in town. We believe there's one child right now who needs to use this, but we keep the contract for any point whenever children come in and out of the program.
Okay. I'll move it and have a question after.
I'll second.
Questions, comments for discussion?
Unlike the other itinerant services, this is not rate set by the county. This is a rate established by the state, even though in 3 to 5, the county establishes the itinerant rate.
This is right. This is not this really. Oftentimes it is the child will go to the site. Sometimes it is the experts will come in, but a lot of times it's really to get fit for audiological equipment primarily. So it's very unique. It's typically 1 or 2 visits and then done.
I mean, the fact that you say set rate, that's unlike anything else in 3 to 5.
Right. These are uniquely set rates.
Okay.
Any other questions, comments? Hearing none, all in favor of HH3?
Aye.
Any opposed? HH3 passes. And HH4 is a resolution to accept the dual settlement funds.
So this is, as you read a little bit in this resolution, the Attorney General went after Juul as a company because Juul they proved that there was marketing specifically to youth for vaping and their product. So there's settlements that are going to New York State health departments and also school districts through their BOCES, and in New York to those particular school districts. For our county, our health department, it's $397,000 plus, just over that, to be spread out in 8 installments, they said, but they want those 8 installments for 5 years. So we're supposed to get sometime in the next few weeks a chunk of 3 installments all at once, and then 5 annually thereafter. It could be a little less if Juul wants to pay in advance. And then there's been one webinar where we spoke, where the AG's office spoke about how this money can be used. There's specific functions that they want this to be used on. We did ask if there is a manner where there can be an administrative percentage that can be utilized by, the health departments for this purpose. We did not get affirmative percentage. We think that is possible, but we're really still waiting to get the contract. We're going to get the money through there, but then the stipulations will be on. They're supposed to send us something in writing through the AG's office that has not, I imagine it's being vetted because they have not sent it to us in writing as yet. But they have given us information about how the funds can be used, which is primarily prevention and education geared toward youth to cease or not start vaping.
Can I ask a question? Is, you
I'm
said
gonna
this
move
would
it in
be,
a second.
oh, I'm sorry.
I'll move it.
I'm sorry. Second, yep.
I'll second.
Okay.
Did you say it was supposed to be dispersed through schools or county?
Both, actually.
The schools are getting a portion?
They're getting a separate funding. So health department, we're getting the whole 397,000 and Cayuga Onondaga BOCES is getting a chunk of money also for the same purpose,
Out of that or separately?
separately,
Okay.
separate amount.
Do you know what they're getting by any chance?
I'm sorry.
You know what they're getting? You don't know.
I did see it. I did not write it down. I can look it up and get back to you. I can let you know what it is. If I guess it, I'll be
I'm
wrong.
just wondering because like each school district not getting just BOCES and us.
Correct.
Okay.
And this is totally coming to local health departments.
Yes,
And there'll be requirements for work that the health department has to do
correct.
to spend this money, like
Yes.
our health I mean,
It is to prevent youth and young adults from initiating vaping. We can do it through helping people quit vaping, supporting community, college, universities, anti-vaping programs, enforce vaping laws and regulations, research and surveillance. We don't do research around this and at our local health department, so that won't be done, but we're going to have to create some programming around this and we can work with partners to do it, how we choose to. But honestly, we haven't gotten the money yet. This can had been kicked down for over a year because about a year ago, we learned about this settlement and it's taken this long to kind of beat up and find out how much we should be getting. So I'm fully anticipating a little bit more structure around it. But I think we're going to have a decent amount of latitude in how we perform these programs.
you don't envision having to add staff to do any of this, I would.
Well, no.
Mhm.
However, I plan to talk about staffing to a certain degree when we talk about other things, which will play into this a little bit and at our budget meeting that we have to talk, with as a larger department. And we'll speak more to it as well.
And this is, you're required to accept these funds?
We could say no. Yeah, we could say no.
And are other counties saying no?
Everyone wants the money. Yeah, because we know that, right, prevention is the way to go. There was no one who said no. There's been no sign on the dotted line yet. Because we didn't have parameters yet. So
You have to submit a work plan?
no, they're telling us what to do. From what we're being told, there's no work plan we have to submit. They're going to outline specifics and the state financial system, send the money our way. They can audit how we're spending it. But they're giving us very wide latitude. They're saying, here's the topic areas. But, that's why we want a little clarity, like how much,
Do you have to accept it this month or this is the urgency to do it?
when we had the webinar about 3-4 weeks ago, they said within 2 weeks you should have the money, which is why we said, let's put that on there now because we should have the money any second.
Because without
But today, as of
resolution, there'd be no money.
well, we wouldn't be able to accept it.
Accept
Right, the minute we hit yes on the SFS, the money is going to get transferred over to the county.
I have one more question. Heidi.
Thank you.
This is a total 390, it's not increments of 300. So they're
Correct.
So 300 is 90, and then if I said increments up to 8 payments, you don't know what form of payments are coming.
Correct. Right. They anticipated that this first one should be 3 payments of,
49,000.
49,000. and then annually 49,000 around the 1st of June, they said, for the next few years.
Is there any plans like, is it just education that we could do to tell the people about vaping or the kids about vaping? And is it specific to children?
Yeah, specific to, 18 and under. Well, I believe actually you can do college, so probably kind of that on 21 and under, let's say, because that's the sell, right? You're not supposed to buy stuff until you're 21. We had done some work a number of years ago when we worked with specific school districts, for instance, where there was artwork that students created, which was incredibly impressive works of art that then were transferred into posters that were then distributed around school districts, which was really cool. And it was very effective and it generated a lot of talk. So that's an example of something that's been done in the past. I will be honest, we have not had the opportunity to sit down and talk about the best way we want to work. Are we going to work with BOCES? Are we going to work with some other community agencies? Are we going to do this all ourselves? I don't know yet.
And I have a lot of youth around me constantly. And one thing I just say, I just want to make a statement. I feel as if you see a child smoking a cigarette, you cringe at their age. But vaping seems to be, even pulling up at some of the schools, acceptable. Like it's almost,
Very, very commonplace.
it's almost like there's no, it's not uncommon. Like if you see a 15-year-old or 13-year-old vaping, nobody even flinch at it.
Right.
So you got your work cut out because I don't know.
And it's something, right? And there might be a way I can work with Deb and some of the contacts that she has, right, that we can
So you,
try and maximize.
good luck. You guys will figure it out, but good luck. It's tough.
Any other questions or comments?
And it will roll over. To your point about accepting it or not, something that's not spent can roll over. So we're not forced to spend it all in the next 4 months of the year, this first infusion. We will be able to make a plan and execute it also.
My only caution is, we're looking at reducing county government and we're accepting funds that I hope don't translate into increasing the workforce.
Right.
That's my only concern.
It probably won't be a lot of money annually. It's like, what, 47?
49.
49.
49,000?
Yep.
I mean, you're gonna have to do your best to stretch it as best you can.
Yeah, Deb would help you.
Yes, yeah.
We also have, depending on what you hear from the state, there's opportunities to, we have community agencies, youth-oriented agencies who could probably be happy to develop a plan and utilize those funds, right, with the youth they're working with every day anyway.
Mhm. This is not an area that I am especially concerned that we don't have to hire someone for this if we have staff to do it. And that's where we'll talk about staff next. Okay.
The one public health educator you currently don't have. Is that,
Take that too.
another one just left?
Yes.
Okay.
Any other questions, discussions on HH4? Hearing none. All in favor?
Aye.
Any opposed? HH4 carries.
Okay.
You've got,
So-
sounds like a
Few things for
interesting.
updates. Well, and we can always talk about a lot of things. Thank you for, I'm going to supporting our Board of Health nominee. The Board of Health did unanimously support this nominee. Just so you have a little bit of background,
Support what, Kathleen?
the Board of Health nominee.
Oh, the nominee, yeah.
This is someone who has a nursing degree, has been an EMS provider, has done emergency response around the community. It's really great background that she brings. She's very community oriented. And we really took a little time to look around because we wanted to find someone outside the city. We had good representation from the southern area of the county on the board, but not really from the northern end of the county. And this person was raised in Cato, lives in Weedsport. And so at least it's a little more reflective. Not that Not that public health is necessarily geographic, but it's good to have that kind of representation, I think. So I think she's a really good candidate. Corporate compliance, this is my official report out to all of you. Quarterly, we try to make sure that we go on record. Speaking of corporate compliance, we just had a meeting last week. Usually it's every other month or every quarter for sure that we meet. The corporate compliance committee, Sharina Drosko is our county compliance officer. Mental health has Laura and Liz. Health department as a covered entity as me and Deanna. Members, Rich Graham oftentimes will participate. So we have to do annual training for our public health staff. All of our staff have to acknowledge that they have received this training and ask questions and know the hotline and know who the compliance officers are and know how to report fraud and things like that. So we completed that. Deanna did a presentation and training at our June staff meeting. We will be bringing this to our Board of Health at our July Board of Health so that they have an annual meeting or annual training. And then Shireen will be working to present to the legislature sometime in the next month or two at the legislative meeting for your annual corporate compliance training. Good news is, there was nothing of concern to report, and I think it's important to kind of reiterate the processes that we have in place really do help catch things. So the fact that we're automated, so, I won't speak for Lauren, but Liz mentions how they have a new EMR and that's a beneficial thing. We have a relatively new EMR, electronic medical record for our preschool program. It's called McGinnis. It really does have some stops that you can't submit things for payment if you don't have all the accurate data in there. And if you're missing a piece, then you don't send it. So you can't claim, you can't inadvertently get any reimbursement that you shouldn't unless all the pieces are in place. So it is worth our investment there. We are hearing that that audits, OMIG, which is Office of Medicaid Inspector General, always routinely does audits, that they're giving a little bit more focus to some areas. And some of what we're reading is it's more, it's really not consumers who are, have issues, but it's entities, right? It's businesses, it's operations, pharmacies or billing for patients that don't exist. So that's typically where there's, where fraud is identified primarily. So it's good that we talk about things. I will say that the last couple of, having been part of corporate compliance since it became a thing, probably 10, 15 years ago, the last 2-3 years, I think we've really refined our process as a county and have just a lot better process in place for reviewing things routinely and hitting the check marks. So I'm really impressed with it's doing what it should do, right? The process that we have in place. This is something I want to talk about, licensed home care service agency with all of you and get your opinion on this. I brought it up last month and a couple of times and I had discussion with our Board of Health who supported our health department moving forward with relinquishing our licensed home care service agency licensure. What does that mean? So years ago, some of you will remember that we had, it was called a CHA, Certified Home Health Agency. That was the kind of agency where our public health nurses went into people's homes and they, had a wound that needed dressing or they had a knee replacement and or a physical therapist went into. When the county privatized that service, we became a licensed home care service agency. And that was a requirement of every health department to either had a CHA or needed to have a LICSA because there was an expectation that you performed some level of home care service or be able to do so. And that requires obviously having staff, but there's a number of policies. It's very highly regulated under Article 36 of state public health law. Last year, at the request of health departments around New York State, every health department's a little bit different. There's some very rural health departments who maintain CHAs because they're the only game in town and people will have no service at home unless they have it. So like Essex County has a CHA. We have had the LIXA, but for the last just about 6 years, we have not been performing home visitation. As we evolved from a CHA to a LIXA, it became primarily, our home visitation was primarily focused on maternal and child health visits, prenatal visits, postpartum visits, baby weights, mother's well-being. And that's great, and that's still very important. The way the state worked with us to help revamp LIXAs was to loosen up the regulation if local health departments wanted to relinquish their licensure. And so if we do that, we, as a local health department, are still able to do up to 6 home visits for a member of the community. Again, it would most likely be some sort of maternal or child health visit if we were to do that. And we do not need a doctor's order. We do not need to maintain licensure to do those 6 visits. If a person needed more than that, then they are probably a more complex situation, which should be handed over to an agency with greater bench depth to provide that service, like a CHA. We have not done home visitation in part because of COVID, but in part because the demand was lesser. We have not consequently billed for anything in those past 6 years either. And we have not billed for any home care service. We still do billing for our diagnostic and treatment center, which is a different ball of wax, but that's like our immunizations. Maternal and child health is a need in our community. There are some community-based services that are available to do some at-home care for families that have this need. So for example, there's a Healthy Families program that Cayuga Counseling operates. Different agencies have operated them in the past. And that is not a nurse who goes in, but it's a community health worker who goes in and works with families and can help provide support to the family for a couple of years. There's also another program that the Health Network performs that provides, again, almost like and I'm oversimplifying it, but almost like an advocate to help say, you're interested in going back to school? Let's help you make a plan while you're home with the baby, or you could use some help in getting some more food. Let's figure out how you're going to apply for food stamps, for SNAP. So there's supportive home visitation out there. What we're working with the hospital and the community agencies, and it's, I had some more conversation yesterday with the hospital administrator about this. We've been working with the Auburn OBGYN practice. We work with the hospital labor and delivery. Our goal is to continue to get referrals from those offices for prenatal and postpartum women. And what our nursing staff is doing is taking each of those calls, following up with that patient and just assessing what are your needs. Would you be interested in a home visit and participating in a program? Because we can refer over to these programs for you. How are you feeling? Could you use some support? Oh, you're breastfeeding? Great. We could, if you have any problems, give us a call because we can help you out with that. And that seems to be going pretty well. There's some stops and stutters with that referral, but it's a process and personnel turnover, right, on our referring agency sides, but we're working to smooth this out. I'm giving you all that information because I did not want our health department to be on the forefront of giving up our license. And I really dragged my feet on doing, I wanted to see how other counties were doing when they decided to give up their licensure, and did they have any regrets about that? I wanted to talk to some of our other counties to say, why are you holding on to it? where are you finding the value from doing that? I would say in our central New York region, we're about half and half. People who are like, yep, we're getting rid of it. And some who are like, oh no, we do a lot of MCH visits and we bill for them. So we just recently had our licensed home care agency had a survey and it went fine. And they found a couple areas on policies that we needed to fix. And so we submitted our plan of correction that's been accepted and that's just fine. But really that was kind of the impetus for me to say like, okay, why?
You would not be
Let's just-
subject to any survey once you give up your license.
There will be no survey for that.
Right.
That home care. There still will be for diagnostic.
No, for sure.
What if we wanted to get back into it? That was my thinking. Like, what if we find that the needs in the community become so significant and there are not other entities that can pick it up? And we should create some type of home care nursing again. Then we'll have to reapply. If we give up our licensure, then we'll have to reapply. But that means we have to have appropriate staffing. We still have policies because a lot of our policies are overlap with our diagnostic and treatment center. And then let's say we gave up this license and it's 8 years from now, we decide we want to redo it again. Well, you got to look to see whatever the new requirements are. And we work with our state partners and such also. They would be very supportive. I will say that it's a very open working relationship, right? That we have with our state oversight who has to do mandate, that we're following the regulatory stuff. So that was my very long-winded way of saying that I would like kind of your support, I think, to go on record with support from this committee. It's not required, but I think it's just good form. The Board of Health supported us relinquishing our license. I think it would be wise for us to have a discussion if you would support that as well.
Kathleen, what would some of the really clear pros be to relinquishing license?
Not have to go through survey, but that doesn't happen that often. Not having to maintain the policies, which there's some required, annual things that need to be done. But then again, those still occur. If we have nurses, for example, we need to annually have infection control anyways. Right? It's administrative. There's an administrative burden that's lifted. Aside from that, there's not really more pros because we haven't been billing, but we still have an electronic medical record that we could if we had to. We have not been doing billable home visits, but we could if we needed to.
Will you still need that electronic medical record?
Yes.
Only to bill for
We
immunization?
use it for our immunizations. We use it for record keeping. So we get these referrals that are more telephone consultation that we start with our nursing staff. We keep our notes in there and any other type of communicable disease. Like when we had a TB case, we keep notes in there.
At one point, you couldn't even send a nurse out for lead education
Right.
unless you had a licensed home care agency.
Correct.
That would not be a consideration now at all.
Correct.
And you're not always using nurses for that role anyway.
And I would say that was one of the things that was a serious consideration also. And it was, with the staff changes that we've had over the last couple of years, what are the odds we would be able to maintain, right? If we needed to get our LICSA back, it's going to take a lot of work and a nice chunk of money to attract nurses to want to work here to be able to do that work.
Be the same thing. If there's other entities to do that work, why would government assume that again and restaff up for nursing visits that you're really not doing? I think the board fully supported that this made sense to relinquish.
Now, I had this little worry in the back of my head, what if, right? We are a very rural county. We know that home care is an issue. Brenda talks about it, others talk. We don't, as a local health department, we don't supply that type of care.
Because you're not doing
No.
that service at all that would be.
We're not doing home health aid. We're not doing traumatic brain injury. We're not doing wound care. We kind of became a specialist in the maternal child health because other entities were trying to cover that. We couldn't even expand to provide that service because we don't have that kind of clinical bench depth right now.
There are other licensed home care agencies in this county.
There are others that serve this area.
but not rooted here.
but not necessarily rooted here.
Yeah.
And I'm not saying anything to you that you don't already know, both for certified home care and for licensed home care. It's getting harder and harder to get people to serve our community members. Nonetheless, yes, yeah, nonetheless, I bring
No,
it to you.
I was just gonna say, and again, I'm just gonna play my ignorance here, and leave it to the experts. As far as giving up, licensing, I'm not a big proponent of doing that. Usually it takes more hurdles to get it back. If we do need it, then it would just keeping it active. But I mean, that's something that, I'll support you on what you decide, but, and it goes in many levels, You pay the fee and you just have that, whether it's an LPN or RN, you keep it, you don't use it, but you have it. And some, God forbid, we have in a situation where you need it, we're covered. So, I'm being ignorant on this, but if you guys don't think it's something that we need to maintain, then I'll support that. What do you think?
I think my concerns are right in line with Bob, and almost to the point where I don't know, I see more detriment than positive, but like I said, I don't know. Because getting it back is it very difficult?
It will be a lot of paperwork. One of the things that makes me feel better about bringing this before you for consideration is the fact that we can still do 6 visits. And that's not an insignificant number of visits. A lot of times when we did do home care routinely, that was about all that we needed for the type of work we did. If we wanted to go back and reapply for licensure, we're not getting rid of our policies, right? So we have a base to start from. It would take us a few months to do it, but it would be feasible. It takes working with our state oversight. It would be more of a paperwork process, but it would also be recruiting additional personnel at that point.
And you would have to staff up. And if you're not billing, there'd be no revenue coming in against those expenses either.
Correct.
Unless, like you said, you get back into it because, we're the safety net.
Yes.
Especially with the health department broadening their spectrum in a sense. And that's where my concern is. Should we just
Keep it.
Sit on it and
keep it and not?
And what do you feel the probability or want to get back into it would be?
We haven't used it for 6 years, essentially. Do I think if we were to get back into it, I don't think it would be for maternal and child health care. I think it would be, we would probably want to go to a CHA again, the certified home, so that we could bill Medicare and Medicaid. That's a lot of work.
millions and millions of dollar operation in it of itself.
Yeah, all right. We did it back when, but it's been 15 years anyway, since we, as a county, privatized that. And at the time, business-wise, there was a lot more competition. And I know I'm talking both sides, but I'm just like, I want you to know that we've really given a lot of thought to that. That's why we didn't try to pull the trigger right away regarding this. If we wanted our LICSA back, I'm not as concerned about getting it back. But if it's for the purpose of more complex work and to bring in revenue for people, right, who need at home, who had their knee replaced, we'll just say that. It's going to take a lot of work to do that. Even now with our licensure, we're not in a position to do that kind of work. We have 3 nurses. We have no aides. We have no physical therapists. We have 1 person who knows how to appropriately do the billing. We're teaching another person how to. It's going to take a communal investment to scale up to that level, should it be needed. And we would want to make it a CHA because we're an aging entity. We want to be able to bill Medicare. And the certified part is we're certified by CMS, the Centers for Medicare and Medicaid Services. So that's the difference between the CHA who can bill Medicare and Elixa who cannot. So we can only do Medicaid and commercial insurance, but not Medicare with our Elixa. So I appreciate your concern. If you want to think on it for a little bit too, that's fine with me as well. I mean, there's not a rush to do this, but we kind of dragged our feet already about, considering this.
The board is leaning toward.
The Board of Health did support relinquishing our license. Yes. But they asked some very good questions, just as you all are as well.
And even without the licensure, like you said, an individual mother, child can receive 6 visits.
Yes. Yes.
Which is, like you said, has turned out to be sort of our niche right now.
And we would facilitate getting someone into another additional assistance. We would never just leave somebody high and dry. We'd find a way, right, to provide service.
I sit on the Board of Health, so I was already part of the original conversation, but you guys, like you said, if you want to wait a month and give it some more thought, by all means.
What changes in a month though? Like,
Right.
it's more,
Nothing.
we're gonna be stuck at the same.
Yep.
I will tell you around New York State, it's more people, more county, like Dutchess County just gave up their Lixa. There's maybe a third of the counties that have CHAs. So that means that 2/3 had Lixas. But of that, at least half no longer do. So I think there were a number of counties, just like technology, early adopters and others like, let's wait and see how we like this and see how they do first. And so more of us are giving consideration.
I think there's a question that none of us can answer with recent legislation, federal legislation might be harder to get with some of the cuts to administration costs to get. I'll just tell you, I'm leaning toward not supporting giving it up, and I just don't see any positive in giving it up. I don't, and I see there could be more. I like to have the option of having it available to us in case we ever need it and go in that direction. And I want to be fair to future legislators. As, this legislative body changes, the conversation may never come up again, that we have to go through, wanting to do this. And, if we had 10-year terms, I might think about it, okay? Right? We do have 12-year terms, but we may not all be here, right? So I just want to fairly just tell you, I probably won't support it, but I do support most of what you do. So I'm just saying,
Yeah, and
I don't support it.
Yeah.
Okay.
I'm not losing sleep over it either way.
Yeah.
We have to maintain some administrative work with that.
The fact that you essentially haven't used it in 6 years, though, is.
I don't see us using it in the near future. I don't see us needing it in the near future.
You have to have a supervising license that oversees it.
Correct.
And at one point it was your director of community health services, then it was Dr. Joya. I don't know if it's Dr. Archer now. I don't know.
Correct. So, back when it was easier for us to retain nursing staff, we had a head nurse, so to speak. And that person is the one whose license was on there. And then we've gone a whole year without having someone. It needed to be a bachelor's prepared nurse, right, who was on there. We did not have one, so Dr. Joya did it, but and it was during that year when we did not have someone administering exclusively. We did, that's where we got our dings on our survey. Because I'm like, oh, yeah, I forgot to, because it was me. With Deanna, we didn't have a deputy at the time. Like, oh, I didn't do evaluations on them, the nursing staff we had. So ding, Annual evaluations need to be done. Okay. You know, it was a few things like that where there wasn't someone who was, like, when we finally did get to hire Dr. Archer, you have to have an attestation about, no substance use. Well, she got the all clear, but it did not say those particular words. Ding. So that was our second citation that we got. So I will also say the surveyors had never gone to a site and they told us this where there were 0 patients to evaluate.
Right.
Yeah. That was highly unusual for them. That just had never,
Essentially aren't doing home visits, nursing home visits any longer.
we are not and have not been.
Does this, if we were to give up the licensure, is there any financial advantage to that? Are there positions beyond the built-in administrative work?
There is not a singular position that is associated solely with the licensure. Because we still do need clinical staff to perform some of our diagnostic and treatment clinical programs. And we don't have right, there's not a lot of give there.
Well, it sounds like, you're looking for feedback to take back to the health, the Board of Health.
If you
From us
choose to
tonight.
wait, or if you choose not to support, I'm going to inform the Board of Health, who already did support it. And so it just means that you have different opinions and.
Right, right. Well, I just sort of wanted to take a friendly, as the Quakers say, a sense of the meeting about where people are at with yay or nay in support of keeping licensure or relinquishing licensure. I'm going to trust the experts and the 6 years of non-use and support the relinquishing of the licensure.
That's how I feel as well.
And
You can,
No.
no,
Because I would support relinquishing it.
Yeah,
it's early
Yeah.
we're just being told. It's hard to.
yeah, no,
Yeah.
I'm going to support keeping it. Health is ever evolving and I can't say too much. I have a question to ask off the record, but there was a situation recently where it's something that we didn't know we were going to have to deal with. Could that be the home care services could have been utilized perhaps? I don't know. But I'm really on the fence, but as I said earlier, I'm one for keeping it, but I'm not gonna get in the way of if you want to give it up.
So I guess I would say that what you're hearing from this group is a mixed bag that you can take back
Okay.
from to the Board of Health from this committee.
Sounds good.
And this is the first time I'm hearing about it, so.
Sure. Right.
I just think that, I just feel as if just not having the flexibility and also, nobody's gonna archive this conversation. So if 10 years from now, everything changes, it'd be nice to have it. And then there might be new regulations to make it harder or whatever. And if we have it, it's an asset to me, even if we're not using it.
and you wouldn't be subject to survey for another how many years?
It took us 13 years to get this survey.
Right.
And it could be anywhere from,
You wouldn't have to change the way you do business by either way at this point because you haven't been doing business
correct.
in the area.
We just don't want to be caught having the same citations and a resurvey. That would be a negative thing. But they weren't patient-centered citations anyways. So
No questions to even
Yeah.
review.
Yeah.
Okay.
Yep. Just a couple more things real quick. Rabies, we're still looking for rabies specimen preparation. Keep the word going out. Maybe I'll resend information to people again because we definitely need that. We are, 'tis the season for a lot of bats getting to people's homes because it gets so warm, right? And so they come out of the attics and they're flying around and down, in bedrooms and living rooms and the doors are open and, banging in and out. A lot more, so it's a lot more exposure to bats. So we really want to remind people to capture the bat. Do not kill the bat.
Capture the bat.
Capture the bat.
What else to do?
Capture the bat.
Hard no, okay?
Yeah. And we have a video on our YouTube channel and connected to our website, and we're sending some more information out about it. It really is a case, get your little plastic Tupperware thing and put it on there and slide a piece of paper, put the lid on it, hold that bat and call the health department. We'll come pick it up from you, or you can drop it off at the health department and we'll get it tested. And that way, nobody, if we can test it, you're not getting shots, right? Depending on, right, and that's all dependent. I'm oversimplifying a little because there's exposure issues, but
Tennis racket.
tennis racket might smush
The brain.
the brain. Yes. And then if you were exposed to it, you're getting shots.
Like 5 or 6.
Yes.
They're painful too.
Yeah, they're not, and we are paying for those. And that is, it's tremendously $10,000 for baby shots easily
For one person,
for one person. Yeah, if for whatever their insurance doesn't, and there's certainly plenty of times when somebody doesn't have insurance that we've paid the full shot. So capture the bat, a lot cheaper to test it. Plus you don't need shots.
A bit though, right? You're not just testing random bats like catch one of
Or
them.
not. So it depends on your exposure. That's where it's really call the health department. But if there's any question, capture it and then call us, tell us about it. So like if you had a baby asleep in a room and you found that bat, the baby can't tell you whether the bat swooped by it.
Adult, there'd be a
A
recommendation.
sleeping adult, there'd be a recommendation, an adult who was incapacitated in any form, who couldn't recall.
It's scared to catch it.
Or just a known, like it came down and hit me. There's a known exposure.
It touch you and give you the rabies.
It can be a very light, bat bites are.
I'll tell you now, I am,
So
that's one,
light.
I have one phobia. That's it.
winged thing. So maybe there's somebody else who can capture it.
Yeah.
Yeah, we can work on that.
You
start not volunteering.
I could probably make it a height.
I think Elaine said she's over it.
A good spread. Wow.
Information on programs that we have, public health preparedness. The state heard that their federal funding is being pared back, but not eliminated. So we anticipate that may have some trickle down to us with the public health emergency preparedness funding that we receive. We do not have specific information about that yet.
Because that's HRI, which is federal that comes to this. Okay.
Correct. Yeah. Still, it's really kind of a lot of wait and see with everybody else. We have hydrilla control within Cayuga Lake has begun in very specific areas. We are testing the water in those areas weekly, just to make sure things are operating as they should and staying within the parameters that is acceptable. And we heard, word is there are a lot of HABs on Cayuga Lake. Yesterday we got reports about that, and that's really unfortunate because it's early in the season for that. Usually we wouldn't see a lot of HABs. It used to be until we'd had hotter weather a little longer. It was typically August, September that we'd see it, but there's.
Where did your reports come in from? Because last night we heard the opposite actually from Soil and Water Conservation, that because of the colder spring, they were seeing less.
Was DEC reports that people can report to the DEC.
Okay.
This is what's been reported to us on Cayuga Lake. Now, we haven't heard it on Owasco Lake at this point in time. Yeah, but I'll I'll share with you that information too. What we
Okay.
got, so you can have that.
It was specifically was Cayuga Lake that was mentioned last night as looking good, no reports, et cetera.
Recall, that's your recollection, Deanna?
Community Science Institute also
Yeah.
has seen them, and they've been reported on the Seneca County side of Cayuga Lake, but there's a few that have popped up on the Cayuga County side recently, the past couple of months.
Yes, community sciences, they do the lab analysis when water samples go in. So
Thank you. Anything else?
that was a lot. I think that's enough today.
Thank you.
Thanks. I didn't talk about staffing, but I'll see both of you
Real
tomorrow. We'll
quick.
talk more about staffing. Thank you.
Lauren Rush, come on.
I don't have any
You
resolutions,
have
but I
no
just have
resolutions tonight, yes.
just a couple updates. Just updates on the competency restoration. We have one person that has been ordered to go to the hospital next week. I'm trying to kind of intercept that to see if there's anything we can do to reevaluate her competency before she goes. And then we have one more who needs to meet with the third doctor.
Do you have one in already?
We have nobody in right now.
Okay, so
We had two people go on, not on 7:30s, they went on a 5:08, which is a person directly from the jail who's too sick to be at the jail. They can't really keep the person safe. We had two people go for one went for about 2 months and one went for about 5 weeks. So those are a lot shorter stays than we were seeing, especially last year. But we have one potentially going. It's a matter if I can get two doctors scheduled to see her in time. And then the other one is just the third doctor has to decide because the first two didn't agree. So I'll keep you posted on those. I like to keep you guys in the know about where we're at.
the 508s are as expensive as the 730s?
Yeah, they're the same.
Essentially.
They're the same. But they happen a lot quicker. So if someone's in jail that really needs that, I feel like if they go, I also don't think they stay as long usually on the 508s. Because it's not, restoration, competency restoration isn't like a requirement, but the person usually started on medications, which then can usually help them become more, reality based and be able to actually be more competent, even though that's not necessarily what they're doing there.
That's one of the lines you'll evaluate at the Ways meeting when you talk about your budget and.
Yes.
Yes.
We have not received any bills for those two people that went, so that, which is kind of odd, but, so we're kind of waiting for those. We are moving forward with applying for the operating certificate for the satellite in Moravia. So we're working with Moravia School District. There's a lot of things we need to figure out as far as referral. There's a lot of things on the application that we're trying to figure out with the school district. And just to kind of refresh everyone's memory, that is an extension of our clinic where we are able to bill for all of those services, just as we do in the clinic, and actually at an enhanced rate. So that rate is 125%. We would get at the clinic, and if the school district is identified through the state as a high need district, we do get some startup funding through the Office of Mental Health as well. Some startup funding to start those satellites. And I believe Moravia is one of those. So we would receive some of the startup funding as well, on top of also being able to bill for all of those services.
Do you have other satellites in the schools?
We do. We have a satellite in Union Springs. We've had that's one has been established the longest. It's gotta be like years that we've had it in Union Springs. And then we also have a newer one in Weedsport. This is its second year for Weedsport.
Satellite clinic.
Yep,
So this will be the third school district you're in,
correct,
not to be confused with doing the work of the school social workers.
correct,
Okay.
correct. So this is really to cut down on the barriers of those families needing to come all the way to Auburn, to go to see a therapist and, get the services through our clinic. So we'll be able to do it right on site at the
You
school.
still get doctor's orders, you still bill everything.
Yep, everything's the same. That's the same.
And wasn't there some talk about Port Byron wanting to come on board with a satellite?
Well, Cato was sort of the next one, but they're in between superintendents, so we can't really make the decision with their district at the moment until they have a new superintendent come in. Port Byron mentioned it, but they're, I think, looking at Helio Health first too, to see if they're able to, because they have already have some other services in the school through them.
Tell me that, I'm sorry, the three schools again? Marie?
Union Springs, Weedsport, and then we're working on Moravia.
Okay.
And then, Cato is next because those are the school districts that were doing the DBT in schools work. So the idea is that this is helping sustain some of the school work that we have going on there, but we would be able to bill after the grant is over. And then, I don't want to confuse people, but also for the DBT in schools, the SAMHSA grant that we have, our therapists during the summer are actually providing DBT skills at the Moravia Rec program. So there's like hundreds of, I think there's over 100 kids that go there. And they're providing skills, 2 different groups in the morning at the summer rec program. So they're able to teach those universal skills throughout the summer to all of those kids, which I think is a pretty cool thing that they're doing through the grant. So they're still continuing to do a lot of the work in the summertime as well, and we're getting reimbursed for their time, for their, their salary and their time as well through that grant. And that's all I have for now.
Okay.
All right.
Thank you.
Thanks. Yep.
Brenda. Oh, wait, Christine.
Me?
Yes, it is. Sorry. And you do have 2 resolutions.
I do.
So HH1 authorizes the Commissioner of Social Services to fill a social services attorney. And this is due to the expiration of those fill dates that are only
Right.
6 months.
Right, we had received permission to fill the social services attorney position. It expired in May. We are bringing it back. We have a candidate who has accepted the position, is going to be starting at the beginning of September. And this actually was reviewed by the Personnel Committee yesterday. It doesn't say that in the resolution because we didn't have our meeting until yesterday. The meeting had been postponed. But they met with us and gave permission for us to move forward in HHS committee.
I'll move that.
Second.
Any discussion on HH1?
Much needed, right? How many attorneys do you have in the DSS budget? Just 2?
Just 2 right now. Yep.
And the paralegals?
Yep.
This will kind of put you at full staff.
Any other further questions, comments? Hearing none, all in favor? Any opposed? HH1 passes. HH2 authorizes the Social Services, Commissioner of Social Services to fill 6 caseworkers through the HELP program. This is brought forward from last month so that it had the opportunity to go through the civil service.
Right, we had submitted a
Process,
resolution for
title
2
change.
caseworkers that were not designated help last month. We pulled that because we had been working with Diane in civil service to have 6 caseworker positions designated, classified as help, non-competitive positions. And we've gone through that process. It was reviewed by the Civil Service Commission and they agreed that the position should be qualified for the program. Now we need to bring those positions here with the position control numbers, have them, those classified non-competitive help positions, approved by the legislature.
Any questions? A motion on the table for HH2.
I'll second.
Any questions for discussion?
More candidates without the test, Christine?
That's the hope, is that it's less for folks to do, to be able to let us know that they're interested. The non-competitive, they don't have to take a test. And yeah, so anything we can do to make it easier for people to apply.
Do you have any candidates in the works?
We have, I know that, I talked to someone this morning, they were setting up an interview with a woman. So yeah, as the applications come in.
And I know it's a different department, how comparable it really is, but the 911 center did this with the help and it really expanded their pool of candidates to be able to get people.
People don't want to take the test and hope they pass and
It's been a great tool.
Yep, it has been a great
New York
tool.
State has given us.
Mhm. This was also reviewed by the Personnel Committee yesterday. And they gave permission to proceed forward.
Any other questions, discussions, comments?
Is this out of county budget?
So the caseworker positions are already budgeted.
Okay.
It's just changing the classification from caseworker to caseworker help.
Create language that screws
It's-
everybody
yes.
else, but they're already existing.
Yep.
Yes. Any others? Hearing none, all in favor of HH2?
Aye.
Any opposed? Carries. And your report?
Can I just say a few things?
Yes.
Okay. So I'll start with the good news. We still continuing to stay at a lower level with our folks that are receiving services because they don't have housing. Last month when I was here, we were in the 80s for singles and 25, I think, for families, and we're still right about at that same level with a few other folks that are on their way to getting permanent housing soon. So that's promising that we've been able to hold at that level for over a month now from where we were. So again, I attribute it to, the transitional housing program that we have up and running, getting folks into those transitional apartments and streamlining them into landlords' apartments so they can have, permanent housing and not need to be provided with the emergency housing by DSS anymore. And, the rental supplement program, the rent arrears, all of those things I think are combining to help us with keeping our numbers a little bit lower. So very encouraging and, hopeful that it will continue. I am happy to say that as of 7/2, we have everybody that is intended to be at 63 Genesee Street moved in. Huge accomplishment. Work with so many different parts of the county to get everyone in and settled in and get their workstation set up and have the building the way it needs to be to have us be there. So kudos to everyone that helped us get in there. We do still have folks at the historic post office. We have our child support staff there and our case integrity staff are
You
there.
want them near the court? I mean, it's not your
Yep.
fault to move them. It's
No,
okay.
it makes sense.
Yeah.
Makes sense for them to be there. Child support has the regulations that I've talked about with their setting and how it needs to be locked and things need to be secured. It made the most sense for them to be there. And case integrity, they're kind of on the move all the time in and out. There was some room there. It made sense for them to be set up in the front room of that area as well. And then at 2 State Street, we do have our DSS legal staff. So 1 attorney and 2 paralegals now. When the other attorney starts, he will be there as well. So it took a long time, but we're there.
That attorney, you said September start.
Yep.
You did tell Heidi and I today about looking over the OTDA information.
Yes. Yep. You're talking about from the reconciliation bill?
No, from the grant that's being put in for homelessness.
Yes. So I'm sorry,
Housing Visions.
yes, you're talking about the application for HHAP.
Yes.
For HHES, okay. So yes, so the HHAP application by Rescue Mission was submitted not too long ago. And the state is going through their process of reviewing applications. I have to submit a letter that talks about our kind of analysis of their plan for the shelter and the need for housing of folks that don't have, a place to stay in our county and our work with Rescue Mission, if it's been favorable work, so I have to detail all of that out and submit that in. And, the state is reviewing, I would assume all the applications have come in and, siphoning out the applications that they're going to focus in on, and very hopeful that within a couple of months, we will hear news, that the Rescue Mission application was chosen. So looking forward to that. And, we're getting closer to figuring out, where this is going, one way or the other. The other thing that I wanted to mention is between last week and this week, there's been a lot of information coming out by email, WebEx, information coming through about the enacted reconciliation bill, the federal bill. There is definitely impact, particularly in the area of SNAP on the county. and the work of the department and also fiscally. There's a lot to look over. There's a lot of information that they're still saying that they're going to be providing us, but some of the big impacts that we know already is because of the state share of administrative funding is going to be going from 75% to 50%. So what that means is our share is going up.
Are you talking about SNAP?
SNAP
I thought there was no state share, 50% federal.
Administrative.
For
administration,
Cut it back to 25, the federal government.
the federal government, but it's going to impact the Cayuga County.
Right, because there's no state revenue on it right now, so.
So we're going to be paying, our estimate that they gave us just this week is the increased cost, local cost, due to the federal reduction of the SNAP administrative reimbursement from 50% to 75% for Cayuga County is estimated to be $554,000. And that would begin to take effect in October of 26. So it's the fiscal year of 27.
And
So we're going up,
yeah,
up by 500.
Up
yeah,
more.
I mean,
Not cost. Okay.
and just from, having some experience, the programmatic costs, there is no local share.
No.
So if you get food stamps and it costs you get this much in food stamps,
That's
the county doesn't contribute to that at all. But the county has staff or administration to do the program. And for example, Medicaid, it's 100% funded. SNAP used to be 50% funded by the federal government, nothing by the state. And now the federal government is taking 25% of that funding away. And if the state doesn't have a share in it, it will become a local cost.
Right. And they're not saying that the state is going to pick that up for us.
Right.
So that's going to kick over to an increased local cost for Cayuga County and every other county. So that's a huge impact.
And that's October of 26.
Yeah. So starting with federal fiscal year of 27. So that over, beginning in 26 is when we'll start to see the impact of that. There's a lot of other information out there too around some of the provisions that are changing and cost shifting. The SNAP has always taken a look at the error rate for cases. They do an audit sample of cases, and if there's a payment error that gets calculated and there's a state error rate calculation, and what this federal bill is doing is they're saying that based on your error rate, there's going to be more cost to the state as a whole. So if the state has an error rate of a certain amount percent, there's going to be a cost.
The feds will withhold even more of the reimbursement.
Yep. And based on the information that we got, that actually I just found out this afternoon, the OTDA folks were saying that our state, New York State, is along with another 20 states at the 15% state match, which is the highest match. So that means that we would be paying, they said statewide, another $1.2 billion than they have been.
It basically just abolish the food stamp program or minimize it, to the point where.
Make it very difficult for counties to figure out how to.
Yeah. So as far as, some of the concerns that I have around the administrative portion of like what we do with SNAP, I mean, they're implementing some things that we've been relieved of by waiver, which was to, for folks that had to do a work search. If you're on SNAP, you had to do work requirements up to 80 hours per month. All of the different counties of the state, I think except for Saratoga, had a waiver. They didn't have to do that. That's been taken away. All of that's going to be implemented again. It's a lot of work on the staff of the county to track that, monitor that, make sure that all of that stuff is being done. One of the things that they said today on the call was, be very careful not to think that you're going to, reduce staff to try to save this $500,000 that we're essentially going to pay, because the amount of work that we're going to have to do to implement all of these changes with this bill's provisions is going to be very significant, and more that we're doing right now. So
That's the,
Each of those entitlement programs, there's rules about how quickly you see people, how quickly you determine eligibility. That true?
that is true. Yeah, that is true. And the impact on the, clients that, you know, the folks in the community that receive SNAP benefits. I mean, there's a lot of information out about that too, that, you know, the benefit that actually people have to buy food for folks that have food insecurity, is going to be lower. So there's not going to be as much money that they have to supplement, you know, the food that they buy. So that's an impact. And also just these requirements are going to be difficult for some people to, you know, manage and may lose, you know, the eligibility for SNAP. So a lot of concerning things that, you know, we'll continue to work through. The state is promising more information and that they're going to be pushing out trainings and webinars and give technical assistance and help us kind of ramp up for some of the things that we need to do. Some of the things in this bill say that they're effective immediately, but there isn't information yet on, you know, what we're to do next. So we're waiting for that information. There's also a lot of information out there about Medicaid, not as much that we've had actual specific sessions on to talk about yet. So as I get more information about that, I can talk about that probably next month. I do know that there's a provision being put in place to do recertifications every 6 months for folks, and that had been how we used to operate, with 6-month research. And now it went to 12-month and they're going back to 6 months. So again, it's more work on the staff in the unit to gather all that paperwork and make sure that we are determining eligibility when we're supposed to be, and you know, more to come with, you know, that. That was really all I had to talk about today, unless you have any questions about anything.
Thank you.
Thank you.
Thank you. Some up and downs there. Brenda Wyman.
Hi, everyone.
Hello.
So I would like to start, if it's okay, because I don't have any resolutions. I would like to start by piggybacking off Kathleen's conversation, because, and then your comment, that one of the main things our office does is take phone calls from family members or individuals looking for care in the home. They're looking for an aid. You know, our primary people that are serviced from our office are typically in their mid-80s. They're typically widow or widowers. Income varies a lot. We see people on all ranges of the income level. But people calling have a need in, they're not able to drive, they're not able to shop, they're not able to bank. They may not be able to prepare their meals. They may not be able to do their laundry and housekeeping. They may not be able to bathe alone or dress alone. All those services are services provided by aides in the home. And so that's often what people are looking for us to do. We're not Alexa and we're not a CHA, as Kathleen was just explaining that, and we were talking about the county gave up the Certified Home Healthcare Agency many years ago. And while I understand that every single day, I wish we still had it, because we have all these people who want services. And that is the only way people can get services under Medicare, is if they have a skilled need, a short-term skilled need, Medicare will pay for a Certified Home Healthcare Agency to put an aide in the home for a short period of time. There are only two CHAs in the county right now that serve older adults, and neither of them, probably 90% of the time or more, have any aides to send out to individuals' homes. So usually they will get nurses and occupational and physical therapists, but very, very rarely are aides ever available for people who rely on Medicare and need that home health care aid in the home. The only other insurance that covers an aid in the home is Medicaid. The person has to qualify for Medicaid, go through an agency that determines whether or not they can have an aid and for how many hours they can have an aid ongoing. That's all out of the county's hands. We don't typically have anything to do with that unless it's a a home housekeeping only situation. But for all the personal care needs, that goes through the Medicaid process, and that process, they contract with various agencies says that provide those aids in the home. So you have to qualify for Medicaid to get an aid that way. So if you can't get an aid under Medicare and you can't get an aid under Medicaid, there just are no other programs to pay for an aid except approximately $150,000 that we get every year from New York State and the federal government to pay for staff, to contract with, we have about 5 aid agencies we contract with. Some of our programs still have eligibility requirements for the service based on income. So we're able to serve less than 100 people a year, basically, with aid service ongoing. And our aid service is usually 2 to 4 hours a week. So I just wanted to share that. It's kind of, I think there's a misunderstanding about aid service availability or how to get it, or just a lack of awareness, because it's one of those things until you need it, you don't know how it works. Very logical.
Even if you have money and can pay the private pay rate, there is no human bodies to do the work. Right? I mean,
it's hard. It's hard to find someone because you still go through an agency to pay the agency rates to get an aid through them. Availability certainly does vary. And people will pay, go through like care.com and pay for people privately, but it's a huge challenge. It's a huge challenge every single day that we're dealing with. So I wish it was different. Our population is growing. The number of people 60 and over is growing. We have more people living longer with chronic conditions. You're not seeing new nursing homes and new long-term care facilities being built in our area. So we have the same number of beds and facilities, but we have more and more people that need care. And they have a very strong desire to stay at home. And so they're looking for care in the home. And that huge growth and that huge demand, our service availability has not kept up with that. So I hope that helps a little bit understand it's a limited system, really. There's just not a lot to that. So we work really hard to explain those options to individuals and try to figure out which path might work for them. But often it is private pay. It really is, because we can't bill any insurance. We just have a small pot of money to work with.
unfortunately, even if the county got back in the business, it's still the same rules. There's only Medicaid that will pay for chronic care. Medicare tends not to pay, and you can't if you're a licensed agency. So yes, I mean, there's a human shortage of people providing these services.
Right. And that's just a reality we deal with every day. So to kind of jump from that, I also want to talk about sometimes those folks who we're talking to that we can't provide what they want can get very angry. And we've had more incidents and more situations with people who are absolutely frustrated and upset and expect services to be available when we can't provide them. So the way our office space is set up, we have 4 entries. We have 1 staff person that sits at one of our entries, but all our other entries are open to the public because we're in a public building, senior housing. So out of concern for staff safety, we did have from the Sheriff's Department, Adam Bacon, Nicole Stewart, Rob Franklin came in today and did a safety awareness and I forget the exact phrase, active attack training, because our staff are human services staff and they're trained on taking care of people. We set up our offices so that it's as easy as possible for people to come in and us to be accessible, and for people with mobility issues to be able to get in and not have to go through a long path. But that's really kind of yesterday's thinking. Now the thinking is staff need to stay near the door and bring people in, or we need to have our doors locked and only let people in as they, push a doorbell. And that's tough because it's a mindset that we have to work around. It's physical situation that we do not have. I encourage you, if you've never been to our office, to come look. I was happy that we were able to move into something so accessible, but the flip side of that is we're so accessible that we can have people walk in who are very, very angry. And we have a limited number of staff in the office at any given time because some of them are out in the field. So we're kind of dealing with a new reality. We had the training. They did a great job. They made some recommendations. Some are fairly easy to implement. Others are more challenging, especially ones that involve structure or alarms and things like that. But we'll be looking at that. So I just wanted to share that. It's just a different reality. We don't have just the, cute little old women that are playing bingo and drinking tea. It's a whole different population at this point, and most of them are wonderful, but we are seeing more challenges, more mental health issues. It's different, and so hard to deal with, hard to accept, but a reality. So that being said, I wanted to also just highlight on my report, the Go-Go Grandparent Program. This is a new program that came to us a year ago. We're averaging about 30 calls a month for the program and have provided almost 300 rides since last year. So this is a program that fills in that void of people who need transportation, don't qualify for Medicaid, don't qualify for the VA transport, and for whatever reason are unable to use SCAT. We're filling in with these rides, and for the most part, they're working out well. It depends on Ubers and Lyft. So that kind of transportation is not readily available in some of our more rural areas, but it's worked really well in the area surrounding Auburn for the most part. People have been able to get to Syracuse and Rochester, and the people in the south have been able to get to Ithaca. We might have had somebody get to Cortland. So it just depends on the availability of those drivers. But 300 more people getting 300 more rides is more than we had a year ago. So it's an improvement. And then the other thing I wanted to just share with you is the Senior Resource Fair flyers. So I've got several here, and if you keep trying to share one, that would be very helpful. This is coming up on September 24th. And this is an event, we always have a really great turnout at the mall. They're great about hosting us. We have guest speakers. And this year, with it being the 50th anniversary, Greg Olson, the director from the State Office for the Aging, has come out and talk. So very excited and looking forward to this event. So hope that you'll share it widely, advertising to try to get the word out there. But you have Facebook or a space to put it, or put it in your community somewhere, that helps us get that word out. So I appreciate that. Yeah. Okay. Good. All right.
Thank you.
Thank you.
Deborah Dennis.
Hello, everybody. For the Youth Bureau I'm just starting to get information from New York State on the funding we'll have for 2026 program year. I've started to send requests for applications out to various agencies. We do have 3 sources of funding we get from the state. We get allotment for youth team sports, which I know what that amount's going to be for 26. Youth sports and education, I know what that is. I'm still waiting on the youth development part. They haven't released that yet. But in those 2 areas, the money we will be receiving for 26 is a $25,000 increase from last year. So I am excited about that. That is more funding. And I'm also, out of those 3 different pots of money, 15% from each can go into an administrative cost. So that helps the budget as well for the Youth Bureau. So I'm like I said, in the process of sending that out. I'll send the applications out to the legislature as well. So you can feel free to share that with other agencies that I may be missing. At this time of year, just continuing to monitor some programs that are just getting started. just making sure they're doing what they said they were going to do in their application. And some programs are already done, so I'm just working on getting them reimbursed. And since we did have a lot of new programs this year, the forms they have to fill out for the state are a little different. So I'm just kind of helping them get through that and then working with finance to get them reimbursed and start the whole process over again. So that's what I've been up to.
So the applications for 2026 are up on the website.
I just started doing it yesterday, so I put it on a Facebook page. I have to just upload them different places as well. So I just
Okay.
kind of started that process. So
Okay.
I've never had it directly on our website before. But I can check to see how
Yeah,
to
you
do
can-
that. I think
I
I've had a
would-
link on that before. I think
You
they
could
can link
just,
to it.
I just send
Yeah.
that request to Maren, she could get it up.
Yeah, okay. And then I have in the past too, there's some of those those visual, I can't think what they're called, like those boards, you know what I mean? The messaging boards that are in some of the facilities, we can get the information on that too. Cause I think it helps, when the word gets out, more people can apply, cause it's nice to be able to get new programs out there. So doing a good job with that, I think. And then we'll meet our advisory board, hopefully sometime in August, because I do have the applications. I'd like to get them reviewed by the end of part of September, so we can be ahead of things even more than we were last year. And that's all I have, unless anybody has any questions.
No, thank you.
Thank you.
Okay.
All right, thank you. I think that finishes our meeting. Motion to adjourn.
Second.
All in favor?
I
Aye.
Yeah.